Hello, I'm Dr. Oscar Menendez. I'm one of the chairpersons for this year's Mission of Mercy event.
How you doing? I'm Dr. Chris Bolmus. I'm the other chairperson for this year's Florida Mission of Mercy. We would like to welcome and thank you for volunteering.
The Mission of Mercy event is the Florida Dental Association Foundation's premier charitable event. We're hoping to treat about 2,000 people at this year's event and provide around $1.5 million worth of dental care. We are doing this in hopes of giving these people self-respect, dignity, and eliminating pain.
This year's Mission of Mercy will be held in Lee Civic Center, March 9th through 10th, 2018. It's a great event, it's fun, and we thank you for coming.
We hope to see you there.
Greetings, my name is Steve Zuknick. I am the Co-Clinical Director for the 2018 edition of the Florida Dental Association's Mission of Mercy in Fort Myers. Thank you for your dedication and volunteering to help these patients in need, and you are very much appreciated for making such a big difference in their lives. I'm in charge of the preclinical areas for this event. Those areas consist of patient registration, patient education, medical triage, radiology, dental triage, and patient routing. Please be on the lookout for a series of emails in which you will receive information and a link to protocols specific to the department in which you volunteer. Familiarize yourself with these as well as the site plan of the venue and the clinic floor so that you can be made aware of your duties as well as where you are to perform them. You will also receive important information you should know before you arrive on the day of the event. Proceed to Whaley Hall and check in with volunteer registration, where you will receive a shirt and a name tag. You will then proceed to the Lee Civic Center and go to your specific department and check in with your department lead. They will provide a verbal orientation with the rest of your shift. Your lead is there to assist you and help you have the best experience possible. But please help them by being as flexible as you can be. We are all out of our element, but what you are providing for our patients is beyond fantastic. Thank you again for being a part of the Florida Dental Association's Mission of Mercy, and I look forward to personally seeing you in Fort Myers.
Hi, I'm Dr. Susan Byrne. I'll be in charge of this year's sterilization at the Mission of Mercy event. I want to thank you all for volunteering to work in sterilization this year at the Mission of Mercy event. If you're registered to volunteer in sterilization, you must have your hepatitis B vaccinations. If you do not, please let our head lead volunteer know so she can redirect you to work and volunteer in another department. During this event in sterilization, all volunteers must wear masks, gloves, protective eyewear, and gowns, which will be provided for you. No open-toe shoes will be allowed. Anybody touching contaminated instruments must wear heavy-duty utility gloves, which also will be provided, and gloves must be worn by anybody touching dirty instruments. We will split volunteers up into dirty instrument volunteers and clean instrument volunteers. If you are a dirty instrument volunteer, you will clean instruments, bag instruments, and load the sterilizers. Clean instrument volunteers will turn the sterilizers on, unload them, and sort them back into the appropriate bins to be redistributed throughout the clinic. The protocol is in written form. It will be emailed to you before the event so you can review them. If you have any questions, you could email the ADA or email myself at sbyrne1538@gmail.com. Our protocol will be as follows. When instruments are brought to the sterilization department, they will be brought to a dirty area or the used area, which then the dirty instrument volunteers will take. They will be inspected to make sure everything is only instruments, that there's no cotton rolls, teeth, sharps that need to be discarded. They will then be run in the ultrasonic for an appropriate period of time. Then they will be dried and bagged or placed in cassettes, which are already predetermined with a certain color. Hygiene is purple, green is restorative, and blue is for oral surgery. Doctors' instruments will be placed in paper pouches and labeled with their names. If not, they will go in nylon pouches or the cassettes. The dirty instruments that are then bagged will be placed on trays and loaded into the sterilizer by the dirty instrument volunteers. Clean instrument volunteers will then close the sterilizers, turn them on, and run in the pouches mode and run for the specified period of time. They need to be allowed to dry for at least 10 minutes after the sterilizer opens, so they do not overheat. The clean instrument volunteers will then remove them using the pot holders that are provided. They will then make sure that the bags are not perforated and that they look like they have been sterilized properly. Then they'll be sorted into bins, which will be labeled with the instruments of what goes in that bin for what area. If instruments are returned to our department and they're not used, they are to be inspected, make sure the bags aren't torn or ripped. If they are, they need to be rebagged and re-sterilized and then sorted into the bin to be reused in the clinics. And hand pieces that are returned to us need to be wiped down with alcohol wipes, which will be provided, and then bagged and sterilized as appropriate.